Hello, and thank you for joining me today. I am here to present a new policy procedure to your office that I think would help create more positive and trusting patient provider relationships. Um, Today, I want to talk to you about cultural competence and how that interlinks to the cultures surrounding our area for patients of different. Um, Ethnicities and cultural backgrounds, and how the folklore and mythologies in those backgrounds determine a lot of how healthcare is presented to them, how treatment options are given to them, how diagnoses are handled, and how a provider can really build a good, trusting relationship with those patients. So, I would like to start just by saying that a couple of cultures that I chose for examples today are the Haitian culture, the Latino culture, the Native American culture, and the Muslim culture. So of Islam. So I thought maybe offering you examples of how these patients view different ideologies from their cultural folklore and mythologies that have been brought through family traditions and things like that will help in a patient provider situation. I know I always do better with examples, so I thought maybe if I presented you today with examples, you'd be able to kind of see on a first-hand basis how that works. So when we look at the Latino culture, the Haitian culture, the Muslim culture, all of these have a patriarchal unit. So the man is more the decision maker in these family entities, especially in the Muslim culture. There is, if there's very important medical decisions to be made, a lot of the times it's the eldest male or husband that makes those determining decisions. Knowing who to address and when is always a good thing to know when you're dealing with these types of cultures, because you don't want to offend anyone. So in the Native American culture, the elder is the person that usually makes the very important decisions. So usually that is also a patriarchal unit, with the man being the elder, but elder women also have a very important part in the Native American culture. And they also are kind of like the binding of the family. So they are the one that kind of keeps all the glue together. So um, when we're talking about different treatment options and different symptoms and things like that, all these cultures have different ideologies, different folklore that they go back on, especially if they're immigrants, and things that they deal with in a completely different way than Western civilization. So if we're talking about pain, you have in the Haitian culture, pain is usually a lower threshold, and it is something that they will describe as all over their body. It usually doesn't go to one portion of their body like we're used to hearing for symptoms. It requires a lot more from the provider on probing questions to get out of them what they're trying to explain. This also happens with any type of symptoms. They usually are ones to um, explain a diagnosis more than symptoms themselves. So knowing something like that creates a way for the provider to walk into that patient appointment, know kind of what they're expecting out of the patient in regards to explanation, to figure out what is going on with that patient and how they can help them, and then expanding on that to more give a differential diagnosis or a more found diagnosis of what is going on. When we're talking about the Native American culture, in comparison to that, pain is more of a higher threshold. It is something that is felt because everything is through energies and spirituality. So it is not the same as the Haitian culture. They don't want to show any type of weakness. So it's a completely different spectrums. And knowing that when you're dealing with different cultural entities in your office for patients is always a good way to address each individual patient by their culture and their background. So, um, working in ambulatory care, that is something completely different when it comes to how death is associated with severe illnesses. Um, The Haitians believe that if you're given oxygen, you have a severe illness that could be chronic or deadly. Even if it's for an asthma attack, oxygen is seen as something that is used at the end of life. So, usually an ambulatory care setting, even though that is not what your office is about, has all these different things also to keep in mind with different cultures. Native Americans tend to want to stay with their dying or dead relative for up to 4 days after passing. So they don't send flowers, they send food. Obviously, there are certain policies and procedures with hospitals. So all of that needs to be taken into consideration, just as an example, if we were in a bigger ambulatory care setting. So knowing if you have any providers that are on call for ambulatory care in a hospital or urgent care is always a good backup for them to have that information as well. Also, I'm just trying to think of what else I want to let you guys know about. There are so many spiritualities and religions that go into these cultures as well. They are very much forthcoming when it comes to folklore and mythologies, especially with the Muslim religion that deals a lot with the Quran and how they accept certain things into a patient-provider relationship. So modesty is a big one. It has a lot to do with their spirituality and their religious preferences. That is something that's very, very important with that culture, because if that was to that modesty was to be, that trust was to be broken, that'd be a patient that you never see back in your office. So if you have a female that needs some type of exam, it's always a good thing to have a female provider on hand for that patient, because having her in a room with a male provider and having to do any type of exam where skin is showing, for example, would stop that patient from wanting to come back and would completely ruin that that bond and trust that our office or your office has built with that patient. So I will be providing pamphlets for you guys in regards to each culture that we spoke about today, and just to let you kind of see what your providers and staff could use as kind of like a helpful pamphlet for each individual cultural preference for your patients, and kind of have an idea of what their standings are on certain symptoms, diagnoses, treatments, how that mixes and matches with herbal treatments that most of the cultures that we've talked about use on the side, either before or concurrently with the treatments that they're going to be receiving in your office, just to make sure that there are no side effects or interactions. All of that is always a good thing to have on hand. So is there any questions that you may have for me before we get off this little teleconference and I get you your pamphlets?
How do you think cultural competence will improve patient relationships in our office?
I think that cultural competence will improve our patient relationships because they it just creates a bond and a trust and an understanding that that patient knows that you care about their background and their beliefs and ideologies, and it is something important to you, which also makes them feel important and creates that trusting relationship where they're more willing to work with you when it comes to treatment options and dealing with diagnoses, especially more chronic ones.
Okay. Are there other cultures that have folklore and mythology that tie into current day healthcare?
Absolutely. There's a lot. There's a lot of cultures. I just gave you an example of 4 because I wanted to make sure that you had a couple little examples to work with. And then if there's any more that you need, I can always make sure you get pamphlets on those as well, because there's quite a few cultures that live in our geographic area. So,
All right, perfect. Are you available if we implement this new approach in our office?
absolutely. I am available anytime you need me.
Thank you. We will definitely take this new approach into consideration and get back to you.
All right. Thank you so much for your time. And hopefully, I will be hearing from you guys soon. I'll send those pamphlets right over.